Hello and welcome to the CDO magazine interview series. I am Vasant Eswarachari, partner from Guidehouse. Today I have the pleasure of speaking with Kiran Mysore, Chief Data and Analytics Officer at Sutter Health. If you were to continue this journey for the next 2 to 3 years, or even probably a 5-year journey, right? With the evolution of GenAI, the way it is progressing, how do you see what are the promising trends that you see happening in the market, specifically in the health system, including the payers and the PBMs, if you will?
The big trend that I see, for example, is a seamless integration of various modes of data. Data can be structured, unstructured, like text, images, voice, video. This is important. The ability to connect all of this is really important. And this is really helping us get a longitudinal view of the patient, which can then help us really elevate the level of personalized medicine that we can actually provide. We can assess patient risk, for example. We can design proactive care plans. We can minimize the burden overall on Sutter by managing this more proactively. And this will ultimately help us improve the quality of care, improve patient well-being as well. So I'm excited about how we continue to integrate different types of information. The second one I'm excited about is the promise of agentic architecture, right, in healthcare. Now, this is still emerging. It's still very early, but I see tremendous opportunities to improve things like operational efficiency through an agentic approach. We have a lot of work to do, though, to get prepared for this, whether it's good data, good systems that talk to each other, consistency of processes, workflows that are predictable, and some level of human in the loop, which is really important. But having all of these are ahead of us, solved one by one, I think will really maximize the opportunity with agentic. I think AI, as it starts to get integrated in the healthcare system, there is a lot of openness, obviously, to start to using this. But there's also a little bit of a skepticism about its use in the industry. So the key for us is to really think about the right application of these with the right governance and the right trust, so that we can actually impact positive outcomes. So I talked a little bit about the doctor-patient communication, right? So that is a great example. One of the things we are seeing is physician burnout. Like I said, nearly half of US physicians are actually saying they're burnt out. And this really affects the quality of care. And so using ambient documentation, using in-basket messaging automation really helps with this. Now, the main point we're also trying to measure is the information they're capturing from the patients, that is more accurate, right? It captures all of the conversation, so nothing is missed, as an example. So this actually also addresses patients' concerns, right? And that ultimately reduces cost of care. So that's one example. The other example is using GenAI to transcribe radiologists' interpretation of X-rays and other images, right? Radiologists are another category of healthcare professionals who are in high demand and short supply. And so if we can help with their cognitive load, we can lower the cost of care. And this is something we're doing at Sutter as well. Now, speaking of empathy, which I think is another key point to consider, healthcare is all about empathy. We did a lot of work with our in-basket messaging work to really understand how to make sure the messages that are suggested have the right level of empathy. And to do this, we had to train the model, not only with physicians, but also patient advocates, to really understand how the message was being delivered or created, in fact, and then customizing that to even at a physician level. So these are examples where GenAI and AI can really help. And the trends that we see is really doubling down on this and taking this at scale and implementing this even further.
What we have seen is today, from an AI standpoint, they want human in the loop, which is absolutely required because that's where the organic trust building happens. Once you have human in the loop, you understand how the algorithms are working, how you're eliminating or minimizing the hallucinations to get to the results that the clinicians as well as the admin staff is wanting. Once you understand that and there is a trust built, then it goes into the delegation mode. And then that's the phase 2 of it. Once the delegation is also improved, if you will, then it essentially will go into the autonomous mode. I think the way I see this also is for us to focus on autonomous care, is critical. It is something which is the North Star, if you will, but you can't actually go there until you have passed the journey of these three stages, if you will.
Yeah.
This brings us into a collaboration aspect between the man, earlier we used to call it as a man-machine interface. I think it is fascinating that we are talking about the brain-to-brain interface. It's an artificial intelligence and our brain. How do we commingle and how do we make this, as I think 1+1 is not just 2, but it's 1+1 equal to 3, if you will, in terms of an experience standpoint for not just the people who are providing the care, but also the caregivers in itself.
Yeah.
And the inpatients.
Indeed. It's a great observation. And I think one of the key things, innovations or collaborations I'd like to see in the future, right, is to really combine the strength of technology and the strength of human empathy to create a more sustainable set of solutions. So, at the beginning of the talk, I had discussed pilots, right, and how we need, a way to scale pilots better. And we need to bring this whole preventative care at scale. I would love to see us continue to harness data from all of our systems, right? And all of the patients to find treatment that uniquely works for one patient. And, at Sutter, we are doing this. We're exploring how we can do better research, for example, by learning from other systems and approaches as well. And this sort of combines the notion of that human interface with the machine, if you will. Speaking of collaboration, one of the things I'd love to see, right, is how we can connect insights from various parts of the patient journey into a longitudinal record that is accessible to the patient, obviously, but to any system that the patient chooses to share this with. Because at the end of the day, we want to build a connected ecosystem where the journey of the patient is fully understood from the beginning, and that we are able to offer the best quality of care at the time and the place that the patient needs it, through technology and through the use of AI and through the use of all of the digital technologies and tools that we have available to us.
This brings me one other topic which is a bit philosophical. And the way I see this is, I think the journey starts not just for a customer, but it starts within. And the way I've seen this is when you look into the mirror, you look at yourself. I think I pose a different question. Yes, we look at ourselves, but the question that I think is, what does the mirror look back at you? Does the mirror look back at you as a dinosaur, or the mirror looks back at you as a rewired you? And the way I understand from a rewired you is, are you someone who has embraced what AI brings to the table? Have you understood what structured and unstructured data means? Have you understood how does these things connect the dots? And I think if you keep testing and trying things out, you come with some more things. And the way I have seen this is when you deploy AI into a workflow, there are newer streams of work that actually gets happening. So I think the evolution of AI is just going to continue to exponentially increase. That's a very fascinating way of how we look at this. And I've also seen situations where in the past, from a consulting standpoint or an SI or an implementer, we would do it along with the client, for the client, with the client. I think in today's world, people are asking, hey, where have you done it in-house? I think that's a big, big question. And we in Guidehouse have been working on this for quite some time. And we have a plethora of examples from a use case standpoint where we have used it in-house and how we are improving our productivity of our teams in itself. And this is something we want to actually rub off along with all of our clients, if you will. But this is great. Any other thoughts that you have, Kiran, before we wrap up?
Vasant, this is a fascinating conversation. I really appreciate the opportunity to share, some of the work that we are doing at Sutter, some of the trends that we're seeing in the industry, some of the opportunities we see ahead of us. I think, again, a couple of points I want to reiterate, right? I think AI has tremendous potential for us in healthcare, but it's not just the technology, it's not just the algorithms. It is really a combination of many things that include the right application of AI in the workflow, the right consistent set of processes, great data, having quality data in place, and then ultimately the governance that allows us to track these mechanisms, these algorithms and these models, and also make sure that they are not biased when they make their decisions. They don't drift from the original intent of the model. I think these are all important pieces to put in place. Success of AI ultimately is also measured by input and output metrics. So the ability to really measure and get real value by using a keen understanding of input metrics and output metrics, and then being able to scale those pilots, right, and scaling them efficiently, and making sure that we can really apply to all of the different variations that can exist in the healthcare space. So I think sort of combining all of these things together really will make it successful.
That's a fascinating summary, Kiran. I think if I may add on a personal note, right, I'm reminded of my own recent experience caring for a loved one facing dementia. In those quiet, challenging moments, it became clear that while digital tools and data can guide our actions, it's empathy, presence, and the human touch that truly made a difference to me. As we look into the future, I believe let's challenge ourselves not just to innovate, but to do so in ways that restore dignity, uh, foster connections, give back to our communities. I think I invite everyone to reflect on this. And one takeaway I would say is how can each one of us use our unique skills and resources to build a healthcare system that is not just smarter, but also kinder? That I believe is a legacy worth striving for.
I love that.
Thank you, Kiran, for joining us today. For more interviews and insights, please visit cdomagazine.tech.